discuss and authorize the intermunicipal agreement with the town of Litchfield for emergency medical and fire dispatch. Chief Young.
Hello again.
Yes, hello again. So thank you for the opportunity to come back a couple of weeks later and revisit this topic. What I would like to do tonight with authorization is to go through the PowerPoint presentation again to address the key points and reinforce the topics that we discussed last time. So just a brief recap on how things progressed. Back in April, we were approached by Litchfield to discuss the possibility of entering into an intermunicipal agreement to provide both ambulance services as well as dispatch services to their town. During May, I drafted a formal intermunicipal agreement proposal, a draft proposal, and provided that to Litchfield. Additional meetings with representatives from both towns, being our town manager, myself, and the town administrator from Litchfield and Chief Nickel from Litchfield, met to have further discussions and sort of what that may look like from both sides. In July, the Board of Selectmen in Litchfield, in public session, authorized moving forward with our proposal by unanimous vote of 5-0. And then in later July, an updated draft regarding the terms and conditions was provided to Litchfield for further consideration, revision, etc. And we've arrived at a final draft at this point. That final draft has been provided in your packet. It was provided a couple of weeks ago. Hopefully you've all had the opportunity to review that. So to recap the advantages of this enhanced partnership, and it truly is a partnership between the two towns with benefits for both sides. We've had a long-standing relationship with Litchfield through mutual aid for many, many years. In fact, back in the 1980s, we did provide their dispatch services. And I'm convinced from my perspective, had we operated an ambulance at that time, we would be providing Litchfield ambulance service right now. At the time, we did not operate an ambulance, so they decided to consolidate both services over to Hudson, who did run an ambulance at that time. We have served as their backup communications center for over 20 years, so much of the infrastructure within dispatch that we would need to utilize to be able to provide their dispatch services is already there. That's another key point. I think it's also very interesting to think back in this time frame in the 1980s and 90s and into, I believe, even the early 2000s, our town of Londonderry did not have an ambulance. And our neighbors were kind enough, our neighbors in Derry were kind enough to provide that ambulance service to us. And I think our citizens were very pleased that they didn't ask us to pay $1 million plus to provide that service. They helped us out as good neighbors until we were able to take on that service ourselves. That is what we're trying to do here, is be good neighbors. Provide a service to another community that also has major benefits for us providing that service. It's time to pay that forward, because for many years we were in the same situation. The increased staffing will enhance the available resources for both towns. Without getting too much into the weeds, Litchfield has a unique service deployment model for a fire department that does not run a transporting ambulance service. They run a paramedic level first response system, which is going to work really nicely with our system. There's further opportunities to join up with training opportunities to regionalize other services, et cetera, down the road. It's a great partnership. It has all kinds of potential. I'm excited about it, and I think it will only become stronger as we move forward.
On that note, earlier it was brought up the response times to Litchfield, and I think it's worth clarifying that response times to Litchfield is not from when we get dispatched and there's an emergency responder on scene to provide aid. Like the chief said, the town of Litchfield's providing aid with their paramedic on their fire truck, their paramedics on their fire truck. They're sending first responders, getting there in a timely manner to start triage, and we are then coming over and finishing the piece of emergency management. So I don't want it to seem like it was proposed earlier that someone from Litchfield calls 911 and no one's getting there for 17 minutes to help. That's not the case at all. That would be irresponsible. That's not the case at all, and that's not how it's going to work. And Chief Nickel is here if you'd like to ask him questions about how his department operates when it comes to emergency calls, how fast they get where they get in their community. But it's worth mentioning that because, again, that was said earlier and made it seem as though this would provide emergency relief in an 18-minute period to someone, and that's not the case.
Well, we will be able to demonstrate that we can increase our department staffing by 4 firefighter EMTs and an additional telecommunications operator, and those folks will remain available to the Londonderry residents and serve the Londonderry residents 83% of the time statistically. This will enhance the safety and well-being of our staff as well as the citizens and visitors to each of our communities. So within the communications division, the proposed 3-year agreement would begin on January 1st of 2027. It would add 1 full-time telecommunications operator to our staff. In year 1, the revenue that was within the IMA is $47,580, and it increases by 7.5% in year 2, and then another 7.5% in year 3 to the figures you see there. That assessment model is comparable to the communities of Pelham and Hampstead, which we already serve. The biggest difference here is we are proposing that with the new revenue source, we actually add staffing this time. In the past, we took on additional responsibilities to bring in more revenue to the town, but we didn't give our folks more staffing to help out. We just asked more of them. And that is something I want to get away from.
And I think it's worth noting with the dispatch position that it's not 83% of the time. It would be 100% of the time when there's 2 dispatchers working. Because right now, we have 2 dispatchers Monday through Friday from 8 to 4. This would allow us to have 2 dispatchers for 12 hours a day, 7 days a week. That's just an added bonus to London. That's an added benefit to Londonderry. It's not going to detract by bringing on Litchfield the coverage for the town of Londonderry. As it stands right now, we have 1 dispatcher dispatching 3 towns. By having 2, not only does it benefit Litchfield, but it benefits Londonderry because they're not leaving the dispatch center and just going to Litchfield. They're able to handle multiples. And to put that in perspective, there's 1 dispatch center in the state of New Hampshire that has 3 full-time dispatchers, and that's Nashua. Beyond that, Concord, Keene, who dispatch for 10, 12 communities, have 2 dispatchers working all the time. So by looking at what dispatch provides, this is a net positive for the town of Londonderry all the time.
And building off of that, we do increase the workload for the TCOs. It is minimum for the return on the investment. Combining fire and EMS calls in the town of Litchfield will increase the call volume of the calls that come in, approximately 900 calls per year, which averages out to 2.47 calls per day annually. Within the operations division, again, it would be a 3-year intermunicipal agreement that would begin at the same time on January 1st of 2027. The revenue coming in combined with the IMA assessment model and the patient revenue, which we'll discuss in just a little bit, would add 4 full-time firefighter EMTs. We hope to see AEMTs or paramedics apply. We're willing to accept any position that is willing to apply because it will staff additional ambulances. We just don't know what the candidate pool will look like at this time. The assessment revenue in year 1 originally was proposed at $200,000, so I want to be very clear about that. It was requested to negotiate that down to $175,000 in year 1 at the request of Litchfield. That took a full analysis to look at that and make sure that it worked for our municipality, which it did. It transfers the $25,000 from year 1 to year 3. It is still the same amount of funding over the 3-year agreement. As many of us are aware, Litchfield has a tax cap. They have limitations they have to work within. And this is what worked for both communities, is to reduce year 1 by $25,000 and transfer that $25,000 into year 3 where they have more time to plan for those incremental increases over time. The assessment model, how it was calculated, it's comparable, although stronger than the surrounding communities. The examples would be the current Hudson contract, where they provide the service to Litchfield at this time, and also Derry, who serves both the communities of Auburn and Chester. It was based off the average of those agreements with a significant escalator, a 50% escalator on top of that, to make sure that we're accounting for all of our costs within our town. It increases the workload for our operations staff by approximately 620 emergency responses annually, and that averages out to be about 1.7 responses per day. The patient insurance reimbursement, which comes from the insurance companies. When we transport a patient, we bill the insurance and they reimburse us. That would provide the largest source of revenue for this proposed project. We do take into account approximately a 10% no transport rate or percentage, because not everybody that calls an ambulance we respond to and assess or treat is actually transported. And we need to transport to be able to get revenue for that service. So we do deduct approximately 10% of the call volume to compensate for those non-transports, which will not receive reimbursement. And it's very important to note that the calculations we have here are based on historical billing rates, which are very low. A lot of work has been done, credit to the Fire Department Administration and Deputy Chief LeBlanc, in securing all of the ambulance contracts in line with the revised RSAs, the current RSAs that allow us to bill at 3.25 times the Medicare rates. What that is in plain language is more money in reimbursements for the town of Londonderry. We only have 6 months of data right now because those were implemented January 1st. They're already showing the results. We expect the performance to improve even more. So by averaging out between the historical billing rates and what Hudson reported as actual collections in year 2025, that is where we come up with the combined ambulance reimbursements and the assessment funding to total $605,309 total revenue.
Chief, one quick question.
Sure.
Your 10% of responses not resulting in transport, is that someone who has a medical need that your firefighter EMTs are able to get back to a healthy point that we do not need to transport them?
At times. One example would be a car accident. Somebody may witness a car accident, they call 911, we respond. They make the determination, the patient, as long as they're of sound judgment, they can make the determination they do not want to be transported to the hospital.
They would have a family member drive them somewhere if need be? Or...
Potentially, or they may not seek treatment at all. If
Right.
they're over the age of 18 and can make that informed decision themselves, they're by right can do that.
Or say if someone gets cut on their property, you're able to address that situation, but they don't need to be
absolutely
transported.
Yeah. There's times where we may assess they're not transported. We may provide some minor treatment in the field and they don't feel they need to be transported. It's a whole process. It has to be informed consent, a refusal form signed by the patient or their guardian if they're a minor. There's a whole process. But going through that, yes, we have to provide that service. There's a cost associated with it, but there's no return by way of insurance reimbursement because we didn't physically transport.
No, that's good for us and for everyone at home. Thank you.
And it's worth noting the paramedics, AEMTs and EMTs of Litchfield, many times in this situation will be able to handle this before we're probably even on scene. So we would get turned around. They would tell us over the radio. And this happens actually fairly frequently at the airport because the airport has a fire department there who is primarily for the airport, but when there are medical calls in the terminal, the parking garage, anywhere that's on Londonderry property, they will send a truck over with EMS personnel. And a lot of times they will end up canceling us before we get anywhere near the airport because those people don't need to go to the hospital. So
I see like the sick person calls in for the airport.
correct.
Those kind of
And so it's
situations.
just worth noting that we won't be driving all the way to Litchfield to then turn around and drive back for no reason. Litchfield, again, has competent personnel who have the authority to make those decisions prior to our arrival and will probably do so in a lot of these cases.
That's good to hear. Thank you.
As soon as they make that determination and they cancel us because they are in charge of their own service area, they make that determination. Our ambulance is then immediately available and in service for another response that may be within Litchfield, likely within our town. So the year one cost to provide services, The firefighter-paramedic wages total $276,581. It is important to note that we base this off of a Step 4 firefighter-paramedic. That is a paramedic that would be coming in with a lot of previous experience and come in higher on the pay scale. In all likelihood, are we going to see that? Probably not. So this is estimating high. You'll see that the hiring cost, the method was to calculate that high and then have the revenue estimated low, so that we are going to actually overperform what we're presenting to you tonight. The 4 firefighter-paramedic benefits, we're demonstrating we can cover both their salaries and wages and their benefits within this assessment model. It's calculated to be at $216,392. That accounts for all health and dental based on an average of all the plans that are offered, a single, a plus one, as well as the family plans. That also covers their retirement contributions and FICA, all of the associated additional costs that go into hiring a person to serve this role. The TCO wages for the one additional TCO added to the staff would be $59,571. Again, that's somebody coming in with experience higher up on the wage scale. It also includes, we took the full health family plan, the full cost of a family plan, because this is one person and we want to overestimate what it's going to cost, if anything, to hire somebody. So this is a family health plan, dental insurance, FICA, retirement, again, all included here. And the benefits for that position total $51,601 estimated. So the total cost estimated to add these 5 people, all salaries, wages, benefits included, is $604,146. Subtract that from the total new revenue projected of $605,309, it results in a small net gain. Some folks in my discussions have said that's a very small margin of error, where it's just about level funding itself and there's not a lot of cushion there. It's intended to do that. We want to demonstrate we're covering our costs. We're not in the business of making a profit. We're a municipality, not a private for-profit company. And again, I want to reinforce the fact that we are estimating hiring costs to be higher than we anticipate and revenue to be lower. And we do think this is going to overperform, and that margin of error will be much greater than what you see on the screen here. We were sort of establishing the floor, and it's only going to go up from here.
Chief, were these numbers also taking into account overtime and sick time?
Overtime and sick time is going to be addressed through the overperforming assessment model. There will be some minimal overtime, sick time, vacation time, especially early on, will be very low, because you're talking about new employees who have to gain some seniority before they're entitled to those increased vacation, personal days, et cetera, et cetera.
Right, but I see, one person who's out, all of a sudden that $1,100 goes away.
Could you just explain your
The
question?
$1,100 in net gain, if someone's out, you have to then pull someone in from for overtime.
Correct.
And that'll probably almost negate that $1,100.
And that is the reason why we are going to see the escalations each year within the assessment model. 7.5% is a substantial increase to continue to build off of that. Insurance reimbursement rates will also climb marginally as set by federal standards, Medicaid, year over year. The potential for additional revenue will continue to increase. We will be able to cover overtime cost, training cost, all of those additional things. We will work within the budget that we're allocated, and we're not asking for that budget to increase.
Another item here was equipment per firefighter included into these costs as well?
The way that we address that, it's not only the funding coming in, it is also the timing of the funding. And if you just entertain me for a minute, I'll explain. It's another positive and unique thing where our fiscal year runs from July to June, where Litchfield operates on a calendar year budget. So in year one, we're going to see a full assessment paid in January. That's revenue coming in our fiscal year 27, which has to be used in 27, not carry on to another year. Therefore, we're only having 6 months of an impact on that assessment fee. There's 6 months additional funding there, if you will, to cover all of those one-time costs, like equipping firefighters, et cetera. And they're one-time cost. It's startup cost. It doesn't recur year after year. In year two, the payment would come in and cover the full fiscal year moving on down the line.
And I think when it comes to equipment, we have to understand, too, that that equipment is to outfit those firefighters, but should this contract, and I know this has come up, after 3 years go away, that equipment is still ours. And that equipment can still be used for the members that are currently hired for Londonderry Fire for Londonderry also. That equipment doesn't go away. It doesn't lose its usefulness. We're not just going to throw it away because, say the contract doesn't go through. I think the other thing to note with this, and I'm going to say this because 2 weeks ago, and you weren't here, Ted, we talked about me being the hiring officer. If I could hire 4 firefighter-paramedics with 5 years of experience, I would be ecstatic, right? But the reality is that if you look back at the people I've hired over the last 5, 6, 7, 10 years, that's not what we're getting coming through the door. So that though rightfully presented because we want to give you the highest possible cost, the reality is we're probably not going to see anywhere close to that because that's not what the fire service is showing in any department when it comes to hiring.
I have one last question here on costs. I don't know if you have another slide here on maintenance of the vehicles or not, or if you've taken into account maintenance and wear and tear of further miles on our vehicles traveling into Litchfield. My apologies.
We certainly did take that into consideration. It's important, from my perspective, not to ask Litchfield to fund a full ambulance. We're not asking for new trucks. We're going to utilize the equipment we already have in a greater capacity. There will be increased wear and tear and fuel consumption and things like that because of the increased call volume. A separate part from patient reimbursement, there's also a mileage reimbursement through the insurance companies when you provide transport. The more calls you do, the more mileage you're able to bill for, and that's what covers your overhead cost of fuel, wear and tear, maintenance, even long-term capital replacement. All of those are calculated in at the federal level to come up with what they believe is a reimbursable cost to the cost of doing business. So by doing more calls and adding up the miles, it is important to note it is only per loaded mile. And what I mean by that is you can't bill from the time you leave the station till you get on scene. A patient has to be in the truck. That is what is considered reimbursable mileage. But at every mile we transport from the scene to a receiving facility, a hospital, is billable under the insurance company.
Similar to how you do your taxes when it comes to business miles, right? Similar to that.
Is it a individual that's still with us or an individual, or does it matter?
Is your question if the person is deceased?
Yes.
If
Just trying to be nice.
If the person is deceased, they still bill the insurance company if they carry insurance, yes. Unfortunately, that is part of our business. It does happen, but it is still reimbursable if the patient is deceased. It does not mean that we cannot collect on that.
And the miles as well?
The mileage as well, yes.
Okay.
Any other questions before I move on to the next slide?
We're good.
As far as deployment of the new staffing, there are options available, and we will continuously evaluate how we can best provide the most efficient care. Some of that will be discussions with the local labor union and how we can deploy that staffing model within the current collective bargaining agreement. Those are important. We're willing to work collaboratively with one another to figure out the best way to make that happen. Regardless of the decision that's made and how we deploy the new staffing, we will be able to staff additional ambulances more frequently. That is the end goal here. You'll notice in 2025 calendar year, we calculated or ran our stats, and 52.84% of our calls are overlapping. That means while one call is occurring, another one is occurring. That is a significant amount. And right now, if we lose a call to mutual aid or a mutual aid entity comes over and transports a patient, they get all of the insurance reimbursement, we get none. We are only able to collect revenue if we're physically transporting patients. And that is what this entire assessment is aimed to do, is increase the amount of time that additional ambulances are staffed for both our community and the community of Litchfield that we are willing to take on that increased call volume and demand for. Any other questions on that as far as?
Are we expected to bring on another ambulance as well?
A physical ambulance?
Yes.
No, we're not. So right now we currently have 4 ambulances in our fleet. We have a brand new one we took delivery of recently. We have one that we expect to take delivery of at the end of this month, which was a remount of the box on a new chassis.
Remember you speaking about that? Yep.
Yep. And then we have 2 more that were just authorized recently by the town council that we're putting on order that will replace 2 current ones. At that time, we'll have a fleet, in approximately 2 years, we'll have a fleet of 4 very new, very modern, up-to-date ambulances. And we plan to retain 1 ambulance of the older models that's in the best condition as a mechanical reserve. So when we do have an ambulance that goes out for service or it may be gone for an extended period of time, we have another one to replace it. And that way we can maintain a full fleet of 4 ambulances as often as we possibly.
You're not anticipating to move up to 5?
It would be 5, but we're retaining 1. We're going to have 4.
I guess I meant staffing of 5.
Staffing, no.
Okay.
The 4 would be staffed by a combination of increased staffing and the cross-staffing model we currently use. And the 5th one would be purely a mechanical spare. It would be there to place into service if one goes out for mechanical repair.
Has there been an analysis done about what we can do with staffing a 5th ambulance?
Staffing a 5th ambulance?
And the revenue sources from that and being able to help more people in town?
We have not extended out that far because we're just trying to make incremental progress towards our end goals. And to run 5 ambulances is quite
that would require staffing increases to 16.
Right, I just wasn't sure if what we were looking at for staffing, if it could actually be done with 5 ambulances or not.
It certainly could be with the appropriate amount of funding and staffing to be able to accomplish.
Now, what it is worth noting, though, by adding a 5th mechanical reserve, one, if there's callback, right, and we put page up for callback when people come in, there's an ambulance that in theory could be utilized.
Staffed.
Now, the other piece of this is, with our ambulance aging, we have had times where we've had multiple ambulances out of service. And when you have multiple ambulances out of service and you only have 4 in a fleet, now you only have 2 gaining revenue. If you have 5 in a fleet and 2 go out, you have 3 gaining revenue. So by adding that, you are able to capture more revenue should things go out of service. So the physical piece, even though it's not fully staffed all the time, still allows for more revenue gain when things mechanically break. And as you know, that happens even with new ambulances and technology being
Of
what
course.
it is in vehicles. So.
And as long as, I guess, that 5th one could still be operable and drivable and not just being taken apart for parts.
Correct.
Any other questions before we move forward?
Move on.
I actually had one question going back to what you guys were talking about earlier about the other towns that we service and with our the calls that come in. How often are they experiencing simultaneous calls from the other towns along with Londonderry right now? So the calls from Pelham and Hampstead and as well with Londonderry right now. How often are we getting simultaneous calls from, 2 other towns, 3 other towns all at the same time with only having such a limited workforce right now?
So, Ted, if I understand your question, you're asking about the other contract communities that we currently work with.
Yes.
So the 2 communities that we currently contract with would be Hampstead and Pelham,
Correct.
both of which are dispatch-only services.
Correct.
So
how often are we getting dispatch calls that
Yep.
are simultaneous from those communities
Yep.
as well as
Yeah,
Londonderry?
so our simultaneous call volume that we talk about, the chief put up that statistic 52.8% of the time, is for just the Londonderry Fire Department, where we have
Correct.
multiple calls.
And that's most of the time what we usually
Yep.
get our factoids about is
Yep,
just
exactly.
Londonderry, but
So-
wondering about our workload that we're experiencing from the other communities as well.
It's a great question. And when we have, when you look at a dispatch center versus when we present our simultaneous call volume in for Londonderry, our simultaneous call volume in Londonderry equates to resources being used, an ambulance, a fire truck, a paramedic fly car that are going to a scene that are then tied up for a period of time. That time percentage is what we present as our simultaneous call volume. When we look at what a dispatcher is, we look at their utilization. So it's not actually what the percentage of time that there's calls on the board, because in reality, there's calls on the board where the dispatcher is not necessarily actively engaged in the incident. They have to obviously take the call, they have to process the information, put it into the computer, dispatch out the units, then they wait for the units to get on scene, and then there's a downtime, there's a period of downtime where the units are on scene, and there may be other calls that they're taking to dispatch out other communities.
Correct.
I don't have that specific number off the top of my head.
Right. I'm just
But-
worried, are we not servicing our contract communities enough if we're getting simultaneous calls
It's
for them
yeah,
at the
it's
same time that another call's coming
yeah,
in?
it's a great question. It's a great point. What I would emphasize is that the communities that we currently contract with for dispatch services are wildly satisfied with the amazing work that our men and women in our fire alarm office do. And we routinely receive accolades from both communities regarding how well our dispatchers perform. At the end of the day, they do a great job in there, and it's a very immediate job, right? They have a very short period of time to process and get a call out, and they do a fantastic job with it. And I think that adding Litchfield's call volume to their call volume, in addition to, as the chief spoke about, adding another dispatcher, is going to actually help that utilization time come down. Because right now they're doing 3 communities. We didn't add an additional staffer to complete what we did with those contract communities. With this proposal, the fire chief's recommending we bring on an additional staff person.
Right.
So we'll actually lower their utilization, but still gain revenue from it. Hope
And
that
I do
helps
remember
answer your
from the
question.
reports that our staff in the dispatch center were certainly getting quite overworked as it was. So
They're
I think-
they're definitely they do a fantastic job. They're definitely busy, but certainly there are ebbs and flows as the days go on.
of course,
It's hard to predict when emergency calls are going to happen, but
it can be a taxing position to be able to sit there all day and be able
Yeah.
to take these calls.
And
so-
adding one dispatcher is multiplies higher than adding, a firefighter on an ambulance. From a standpoint, again, like Bruce said, the downtime. By having 2 people, you can have 2 people, one dispatching for 2 communities, one dispatching for 2 communities. That's better than what we're currently doing right now, where you
Right.
have one dispatching for 3. So by adding one, you're actually lessening the load
right.
for the dispatch center.
and also different towns require different levels of service from our dispatchers. So depending on the town and depending on the structure of how they want their call dispatched and what information they want and how they want it tracked, depends on the amount of work that the dispatcher has. But we're very confident that the level of service that Litchfield is looking for as it relates to their dispatch process is very much in line with how we're already doing it for Londonderry as well as Pelham and Hampstead. So it's actually going to help our dispatchers because they're going to be monitoring the same resource. It's a Londonderry ambulance that they were already monitoring before. They're just going to send it over to Litchfield now.
No, I take it right now Litchfield doesn't have any dispatchers. Is that correct?
Correct.
And so a call would come in, it would go into our dispatch center, and then it would get relayed out to their fire station and to their radios.
Yeah, so how it works right now, because their contract with the town of Hudson, is somebody calls 911 in the town of Litchfield. It goes to Concord. They process the call, determine what it is. Then they drop it to when I say drop it, they transfer it to Hudson Fire Dispatch for medical and for fires. Their telecommunications operator will answer the call, get the information, put the information in the computer. Then they send it out as a page over the radio, through cell phones, etc. Say that there's a call. And then they keep track of where the apparatus goes, what their response times are, stuff like that. By taking over this contract with Litchfield for us, all that happens is on January 1st, they're going to take the calls that go from New Hampshire 911 to Hudson, and they switch them over to Londonderry. And it's a very seamless process. We'll do all the work in the background where we GIS all of their addresses. We'll have all their streets in our database, all their hydrants, everything. All that gets done behind the scenes so that on day one, the dispatchers can type in the address and hit dispatch, and everything they need comes up.
And ironically, a number of years ago, past town administrations and fire department administrations looked at taking over Candia, and they invested a fair amount of money into the radio infrastructure for Candia. We've been able to now utilize that radio infrastructure that's been paid for already by the taxpayers in the town a number of years ago for a contract that never went into effect to use towards Litchfield. So there's very minimal to no lift
And
fee.
Candy would be a lot further away.
And Candia was a lot further away, and I can tell you that the contract was far less advantageous. Well, it wasn't advantageous at all for the town of Londonderry. It was just another dispatch service for no additional personnel. But point being is we've already spent the money on that infrastructure a long time ago and it's done nothing. So now it'll be able to be utilized for Litchfield.
And I think it's also important to note that, as the chief indicated, we're already Litchfield's backup communication center. So in the event that Hudson's dispatch center goes down, we're considered their secondary PSAP. So as soon as they can't get a hold of Hudson, it comes over to us anyways. So we already have all of those processes and policies and such built in. We already have that working relationship with Litchfield. It's as simple as our dispatcher just going over their radio and giving them the information that we get. So it's a very seamless transition as it relates to that portion of it.
Anything else? Continue on, sir.
Thank you. So the path forward, after a full assessment and looking at things from all different angles, we've determined that our department is capable and willing to undertake this increased service demand. And the reason we're willing to do that is the return on the investment is greater than the sacrifice of increasing the demand on our services. The demand is very modest. The return is substantial to increase the safety of the citizens as well as the members of the department by adding additional staff. Litchfield will receive an outstanding quality service through a sustainable assessment model. Their costs are more predictable, and we've made sure to account for our costs to make sure that what they're contributing in the assessments combined with ambulance reimbursements will cover the cost of providing this service. Our town will receive the increased staff that's fully funded by new sources of revenue and accounts for all of their wages and salaries and benefits as we demonstrated, and a large majority of the time their services will be committed to our community. Statistically, 20 hours out of every day they will be serving the community of Londonderry, and Litchfield, when they have calls, will provide the service when it's available. And again, that has no impact to the tax rate. We are doing this all through new sources of revenue. That's the proposal, without increasing the tax rate to the citizens. That's a unusual opportunity, and an opportunity that I hope you strongly consider. Before I try to address any more questions that you may have, I just wanted to make a few more points, if you'd be willing to allow me to do
Absolutely.
that. Thank you. I just want to reiterate again, this was a very long process. A lot of thought went into this. I wasn't the only one that participated in this. I thank everyone on the department that contributed their thoughts, ideas, historical perspective of when we looked at this in the past, long before I arrived here in this town. So I appreciate all of that, and I appreciate the ability to look at it from all aspects and make sure that we were presenting something that works not just for Litchfield, but also for our community as well. Now, Litchfield is not asking us to retain an ambulance and keep it in service for them all day long, every day. If that was the request, I would be much more open to talking about more money, covering overhead costs, et cetera, all the things that go along with running an ambulance service. I would support that fully. We already foot the bill for all of that. Whether we take on another community or only provide service to Londonderry, we have the ambulances, we have the licenses, we have the insurance, we have all of that right now. We're not asking to increase any of that. We bear all of that cost. What we want to do is take what we are already paying for and utilize it in a greater extent, which will result in more revenue coming into our department for a minimal increase in service demand. That's the entire goal. The other goal, of course, is to add staffing to be able to account for that increased service demand, which historically we haven't done. We've taken on more responsibility and just asked our folks to do more with the same. That's what I would like to get away from, and that's why you have this proposal to bring more staffing in to address that increase in service demand. But actually, it's going to benefit our community even more than the community who's providing that source of new revenue. So it's a very, very much a positive thing for our town. As department heads, we've been tasked, myself and other department heads in this town, by the council, by the town manager, to investigate alternatives to get to end goals. Look at alternative sources of revenue was a big one. Think outside the box. We've heard that repeatedly. Be creative. That's exactly what we have done here. Is we have tried to look at things from a different perspective and figure out there is an end goal. It's difficult to get to by asking only the taxpayers to fund our objectives. How can we have skin in the game and really contribute to that end goal? And that's what we're providing you tonight, is a proposal with new revenue and a path forward to get closer to our end goals. The reports, the data, the general consensus of my many conversations with the town council, citizens, I don't think I've met a person yet that said that the fire department doesn't need more staffing. I think we all agree on that. All the reports say it, the conversations, it's reiterated there. The problem is we've identified that deficiency, but there's no plan on how to address that deficiency. That's what I'm hoping you trust me, at the department administration, and all members of our department to do, is do that work behind the scenes, do our research, do our homework. I hope we've demonstrated that to you, and we've brought a real plan before you tonight as a proposal and a path to move forward. As far as vetting this plan and taking everything into consideration, in my opinion, there's no better way to do that than to live and experience that. And I have done that for the past 28 years in my career in the fire service. For 18 years of that, I was an employee under a system that contracted to 4 other communities in addition to the one I worked in. We assessed the other towns. It was a 100 square mile radius that we covered in 5 total towns. So I'm elated that we're only looking at 2/3 the size of that land mass and only 2 communities to take into consideration. I don't view that as a challenge. And we have way more resources in this department than I did in my previous department. So there's much more opportunities to be able to provide that service. I've lived this. I have a lot of experience with it. And I can confidently say I would not bring this proposal before you tonight and ask for your authorization to allow us to implement it if I didn't strongly believe in what we were telling you we can do with it. And the final thing that I wanted to bring up is, many times when we talk about providing ambulance service, it's all about the revenue. And I understand that. We have to look at it like a business in many aspects. What gets lost is it's a public service for the better good of the communities. I don't want to lose sight of that. That's what it's all about, is getting the highest level of pre-hospital care out to the citizens who need it. And we have the opportunity to do that for ourselves in a better capacity, and we have the opportunity to provide it to our neighbors through this responsible assessment model. We should not pass on this opportunity. Litchfield is willing to place their trust in us as a reputable organization who has a history of providing outstanding service. I am flattered, I hope you are too, that they look at us in such a light like that, and that we're able to provide them service, and they would trust that service for their community to come from us. And it would not be possible without the people and the professionals that work in our organization that are out there providing this care every single day. At this time, finished my presentation. I would be happy to address any more questions that you may have. And I would just one more time like to thank all members of the department for contributing to getting this to the point where we can present it to you tonight.
Sean, you got a question?
Yeah. So I just had a couple risks looking through this. I'd just like you to address for me. So, the margin, when you look at it, it's razor thin. The department's own numbers show about 1,162 in net benefit in year 1 and over 600,000 of new costs, which is very minimal. Any hiccup in overtime benefits or collections, wipes that out. I guess what would you say to that?
I do believe I've already addressed that, where we specifically designed this to show worst case scenario, for lack of better term, or the floor to be expected. It will overperform what we're projecting here. The hiring costs, again, will be less than anticipated, and the revenue will be more than anticipated. And that is how that margin of error will be greater. I intentionally presented that to show you a very small margin, that we're accounting for our costs, but we're not attempting to go make a profit off of our neighbor. This is about providing a service. When it all comes out in the wash, we will overperform from what we're presenting you tonight, and that's how we will account for that thin margin, if you will.
The biggest cost is hiring, and in this proposal, we have the cost to hire a paramedic at step 4, which is the higher end of their pay scale. Out of the last 20 people we hired, we've not hired a paramedic at step 4. And I would put my youngest son, Carter, who's sitting at, well, hopefully he's in bed right now, on the line that we're not going to hire 4 paramedics who have 4 years worth of service in New Hampshire, because that's the reality. And that's not that they don't want to come here. They're just not out there. We've had to send our members to paramedic school. Hiring cost is the biggest cost. He put it at the highest it could be. And I would, again, bring my 7-year-old in here to tell you that we're probably not hiring 4 people at step 4 that are paramedics. It's just the reality of the New Hampshire Fire Service.
Okay, so next, so most of the revenue depends on insurance collection, so about 60% of projected year 1 revenue, and that's the least predictable piece. Is there something to address that?
Going back again, it's about historical perspective. We have to look at trends in call volume. They increase every year. They're not dropping. So we do expect the calls to be more than we even presented here. The more calls we do, the more insurance reimbursement we'll see from that. It's impossible to predict with certain accuracy how many times cars are going to bump into each other and people are going to trip on the sidewalk. There's just no way to put an absolute numerical value on those things. So we look at historical trends. We see trends moving up with call volume. We see ambulance insurance rates and mileage reimbursements increasing. All of those things point towards the net positive, and we expect, again, as we move forward, the revenue will continue to increase, and it will increase at a pace at or exceeding the town's cost as they escalate with increasing labor costs, et cetera, et cetera.
So in looking at historical trends, one of the big things that's been in this community when I've looked at the historical data is the amount collected versus what we have to end up writing off. And there's sometimes a risk of some of this revenue, especially this being a key piece of the revenue for this, of being written off. Did you look back at and I'm not asking for this right now, but it'd be kind of neat to see the past 3 years of just write-off versus collected. But did you take a look at that data?
Absolutely. Every time that I ever propose anything that is tied to ambulance reimbursement, it is about the historical data of what we actually collect, not what we bill, because there is a big discrepancy there. So the facts and figures that we have presented tonight are all based on the money that we've actually seen come in and trends related to that, not what we actually bill. If we could base that on what we actually bill, which is several $1 million every year, the numbers would look obviously much more favorable from my perspective. But I want you to get a realistic picture of what we're dealing with, not any false information based on those types of statistics.
And I can speak to this, Sean, and I can speak to this because the chief wasn't here when I had to go through the process of applying for and getting the contracts for the new ambulance billing as required by the state. And I don't have them in front of me, and shame on me for not bringing them, but we presented them to you, and the dollars we bring in based on the new state's required billing is higher than the old system, right? But we only have 6 months worth of data because that just started in January, so it's hard to use that projection. But just based on what they're requiring us to charge, we're going to be bringing in more money, right? And hopefully we'll have soon quality data as the year goes on to show what we've taken in from January under this new system. And thankfully we were able, even though some of those contracts didn't go into didn't get signed until post January 1, they were backdated to January 1, so we didn't lose out on that from that point.
And I think it's also important to recognize that those historical data points that we're using are for Londonderry, right?
Okay.
And the payer population within Litchfield is different. Londonderry has an interstate which has cars going up and down it, which is a transient population. We have an airport. There's a much larger basis of transient population that may or may not have insurance, whereas Litchfield is a very nice bedroom community that has, a different payer mix. So we anticipate that payer mix will actually overperform in comparison to Londonderry's historicals.
Okay. When looking through these, there were 2 town fees plus the insurance estimate to get to the number of 584,000. Or the number actually, when I added it up, got to 584,000. It actually cited in here is 605, 309. Am I calculating that wrong?
No, and that was a question we already had, and I didn't mean to cause any type of confusion there. So if you just do the simple arithmetic of the numbers in the presentation, you'll come to that number.
Yeah.
The final estimate that we calculated, the 605 and change, was taking Hudson's actuals and then our actuals and finding the average between those two, accounting for that 10% adjustment for no transports, and we end up at that final number. So it's not simple arithmetic. There were other calculations involved with that. Hopefully that answers your question and explains that. But there was a formula behind how we arrived to that number. The numbers were not pulled out of thin air.
Okay. And so staffing of this is probably the biggest exposure to taxpayers. So we really had an overtime crisis in 2024. The end of that ended up being we don't have a fire chief. We didn't have a town manager. If these 4 new hires aren't trained and on the job by January 1st, this gap gets covered with overtime, which will increase what this is going to be. The same budget line that's already stretched is, might get worse. Any thoughts on that potentially?
The budget line actually, Sean, thankfully to yourself and other members last year in
better than 2024.
Well, much better than 2024.
Yeah.
The numbers we proposed to you last year were the real numbers for overtime, and it did well this year for us. And to be honest with you, it did well, and it did what we thought it would do. So it was stretched. You're absolutely correct, and all the things you said are correct. But last year, through some contention, as you remember, we worked very hard to get an overtime dollar that was appropriate for the staffing, right? And so the line isn't stretched. I think the line is appropriate, and I think the line, as the chief stated, based on the fact that they operate in a calendar year and we operate in a fiscal year, so we're getting 6 months' worth, can sustain the overtime that comes with the new hires starting, right, until our fiscal year begins.
So on the back end of that, so the EMS, the termination is 6 months, but on the dispatch, it's 12. So if we would end this agreement, does that makes it a little bit less of a run? Like 6 months is a pretty slim runway. Is that because we're just going to internalize those with the increased need? How?
As far as the discrepancy between the two, I would like to negotiate a 6-month clause in both contracts. That might have been just an oversight on my part, and I do apologize for that. We want the opportunity, if it's not working for either side, I don't expect it to be that way, but if it's evaluated and it's not working for either side, we need some notification and plan to move forward, and that's why we are requiring that either side gives a 6-month notice of termination of the contract.
And that language is currently in their current contract, so would not be new language to them. That is different.
Well, another thing that's not in there is that the payments aren't guaranteed for all 3 years, which is troubling to me. The way I read the contract, am I reading that correctly?
They would be guaranteed for it's a 3-year agreement. There is the ability to withdraw on either side with 6 months notice. And then we would expect that to be prorated for the 6 months within that current year. But the agreed upon terms are guaranteed for the life of the agreement.
But so worst case scenario though, they get in the agreement, they decide, let's say day 2, I doubt that's going to happen, but day 2, they literally withdraw 6 months later, and now we've got all this spin up with no penalty. That seems like a big risk to me, in a possibility when negotiating a contract, and I'd like to see some terms to make the risk a little lower. The comparable towns are cited. Do we have their actual rate schedules? And I only have 3 more after this. I'm sorry for the time. I just want to make sure we get this right.
The rate schedules or the assessment models. So What they're charging the communities?
Yeah.
Yes, so we have both Derry's contract and Hudson's current contract with Litchfield in hand with those actual numbers.
Okay.
The current signed agreements, yes.
And then when I'm thinking of dispatch priority, it's going to have to stay based on need, not town. So once we take into account Litchfield, and I know you've said this, but we have enough staff to take on Litchfield's calls without quietly eroding. We're making sure that we have enough staff that we're going to comfortably do that, because I guess that's one of my bigger concerns is just
Are you asking dispatch, Sean, or total?
total.
Okay, because you had mentioned you'd started with dispatch.
I did.
So dispatch is providing less work on our dispatchers by adding this, because there'll be more people in there. So you'll have 4 towns, and you'll have 2 people for 12 hours a day. So yes, in the overnights, but typically the overnights tend to be less call volume. Again, don't hang your hat on that, because we know things happen at night. But when you have 2 people in there, let's just say for those 12 hours, they each take 2 towns. Right now, you have 2 people in there for 8 hours taking those, and then that other person is now taking all 3 at once. So you're splitting it. So it actually benefits the dispatchers and the town, because they're doing less work more of the time, right? If we look at it strictly on those numbers. I'll let you speak to the firefighting side of it.
Could you just repeat your question in relation to the firefighting side
No
of it?
problem. I just want to make sure that our capacity stays, that we're addressing the needs of Londonderry. I mean, we're taking on 13,000 people in Litchfield. We're taking on we're already a large community with 42 square miles. I think with Litchfield it goes to about 57. So my biggest concern of all this isn't even the ones and zeros. It's not, we're going to make money on this or we're going to pay for extra firefighters. It's, are we going to be able to keep the capacity for this community in the way that it's been served, consistently and very well for, decades now. I want to make sure that doesn't drop down, because for me, that's the most important part of this.
And that was absolutely taken into consideration. Not only does it does not decrease, the benefit is it increases. So just plain simple terms right now, we dedicate staffing to 1 ambulance around the clock. We have the paramedic fly car, which operates and helps assist with the cross-staffing models in the outstations. By taking on this additional staffing, or adding the staffing and taking on the increased service demand, we will actually be able to staff a 2nd ambulance on a regular basis. But that 2nd ambulance now is going to be dedicated to the town of Londonderry for approximately 20 hours out of every day. So we end up in a better end situation than we currently are without taking on additional responsibilities and service demand. If we stay as we are right now with our current staffing model and don't add any, we remain at staffing 1 dedicated ambulance around the clock.
And then,
I
last
think,
question.
Councilor Faber, also
Sure.
to add on to your point there, because I think it's an excellent point. If we were the town of Londonderry and we were looking at a 400 plus call increase to our community, we would be having a discussion about adding more manpower,
Yeah.
right? Because you all up there would be talking about that as, if we were looking at a very large apartment complex or something that was going to bring in a significant amount of people into our town, and we were going to be estimating that our call volume was going to increase by 400.
Yep.
In this particular case, this is kind of the best of both worlds, because yes, we are saying our call volume is going to go up, but we're also saying that we already can bring in the revenue to offset those costs. So the cost of the taxpayer is going to be net zero, but the Londonderry taxpayer gets the benefit of, if we have 2 Londonderry calls and it takes our 1st ambulance and our 2nd ambulance, and all of our fire trucks are out and we don't have the ability to staff another ambulance, Litchfield's, the way the contract is written, Litchfield is allowing us to then call mutual aid to bring in and to backfill that contractual obligation. So I think your point is excellently stated. We're not asking to increase the service demand and to decrease the service to the town of Londonderry. We're asking to use this revenue to help us enhance to Londonderry while also providing to our neighbors.
That's precisely what I was thinking of, because I know
we hear often, and I don't agree with this math, but if we add a 100-unit apartment thing, we're going to have to build 3 fire stations to have 4 firefighters. We're adding 13,000 people. That's if we added a 13,000-unit apartment building in here, we'd have people screaming about the cost of what services are going to go up.
Right.
So I'm trying to make sure that this balances out and really make sure. So
Excellent thing that you have all recognized, because we've gotten your support over the years from this, is a lot of high acuity patient care can occur on the side of the road, in somebody's residence, in a bathroom. Not to toot our own horn, but we're pretty good at what we do. And we bring the emergency room to your home, right? And so the same can be said for Litchfield. They're going to first response and provide that high level of paramedic level care while they wait for an ambulance to come from Londonderry. And we applied that model with the paramedic fly car a few years ago, where, hey, if all the ambulances are tied up, we can send this medic car and start care. I think John Farrell said it. You want to get somebody to a defibrillator within 4 minutes. Well, the way you do that is with quick response vehicles, and I think this plan also accounts for those two.
Our friends in the back room from Litchfield said their population is like 8,500. Just so
Okay.
Well, I mean, that's
I'm estimating.
I know,
Yeah.
but
Just last question, and I appreciate my patience from my colleagues. So the legal review on this doesn't seem to be done because both agreements are still drafts. There's some duplicated section numbers. There's some mismatched addresses. The notice period we talked about. I mean, how are we going to be able to see a final version of this document? That's be a concern of mine.
So I'm
Do
going
you
to
have
answer
any
that for
input
you.
on that, Town Manager?
What's that?
So we just had a discussion about our legal expenses. I wanted to make sure that we're going to move forward in this before I expended additional funds
Perfect.
to do that. So
Okay. Thank you.
And that's, we're asking for the authorization to allow us to move forward with entering into this agreement and executing that. And I can assure you that further discussions need to be had, not to change the content of it, but to make sure that all the i's are dotted, t's are crossed, et cetera. There's a reason that says draft. There is a little bit more work in cleaning up of those documents to do. Conceptually, we've presented to you what we are intending to move forward with, and we will continue to work on finalizing the draft and making those changes to make sure everything's consistent, in line with what we discussed.
Mr. Chair. Now, we are very much an aging community, and I'm sure Litchfield is as well. I see multiple times a day there's staffing recalls, or all 4 ambulances are out at the same time already right now. What happens when we are completely busy and we can't send anyone to Litchfield? Who's then servicing Litchfield at that point in time?
So Bruce just spoke to that. In the agreement, we would call mutual aid.
And that would either be Hudson or Manchester.
It would be
Hudson, Merrimack,
Hudson or
Bedford,
Merrimack,
Pelham.
Bedford, depending on where in Litchfield it is, right? It's
Yeah.
based off of geographical location. So, like, we wouldn't call mutual aid for Hudson to go all the way up to Litchfield by the executive on Brown Ave, right? We
Right.
would call Bedford, or that's, how their mutual aid agreement would be laid out. It'd be
Gotcha.
no different than us calling mutual aid now to come to our own community.
Okay.
And that's all laid out at within our dispatch center. Litchfield would dictate to us, hey, if you're not available, here are the ambulances in order that we want, depending on where it is in our town.
Right.
That's
We would
all-
just be losing that revenue source. We wouldn't be able to service those citizens.
Yep.
And that's, we would lose the revenue for that call, but we would not lose the fixed expense that Litchfield is paying to us by way of an assessment. Regardless of whether we're not available or are available, that money will stay the same. It's our responsibility to make sure we do what we can to remain as available as often as possible to provide that service to them.
Right.
So
And
the fixed payments don't change, sorry, but we would not get revenue for transports that we do not perform with our own
Correct.
ambulances.
And that's also assuming that we executed on the contract and we have those personnel, and we've already tied that ambulance up at perhaps a Londonderry call. So we're potentially already bringing in the revenue from that call. We're just not getting it from Litchfield. So, but it increases the capacity of the system, which is really the intent of the agreement.
Right. I just know I see daily we're going to the Baldwin, or we're going to the American Assisted Living, or we have multiple calls either on 102 or 93 at the same time. And this is where I was bringing up earlier of, if there was the analysis done of having people to actually staff a fifth ambulance, as this was an item I had spoken about months ago, that we need to be able to service everyone within our town, and if we're going to be taking on another town, to be able to make sure that we can get to people before it is too late.
And we did discuss at the last meeting, some of the questions were raised to the town of Litchfield. Their demographics are quite a bit different from ours. They don't have an interstate. They don't have urgent care facilities. They don't have assisted living facilities. All of those things that drive our call volume up quite a bit, they don't have. And that's reflected in the statistics that we showed you, where their call volume is quite minimal for their.
Are there multiple 55-plus communities? 8 of them? How big are those communities? How many units would you say are in those communities?
It varies in size. We have some small communities that only have maybe 20 units, and we have a couple that have probably 50, 60 units. But they're not a majority of our calls. I mean, basically our calls are town-wide. A lot of people associate a 55 and older and think that you're gonna have a lot of calls there. It's not really any different. It's just an older population living in a community.
Okay, that's all I had right now.
All right. Deb?
Could you just state your name for the record?
Oh, sure.
Sorry.
My name is Doug Nickel, the Litchfield Fire Chief.
Thank you. So we said that we have, Litchfield has a population of around 85, right? Londonderry, in my estimation, even though on the books, according to the census, it says 27, almost 28, I think we're around 30 by now with all the building, and it hasn't just caught up yet. And Londonderry does have the 2 exits. It has the major highway. It has the airport. It has 102. We have 3, maybe 4 nursing facilities in town. This is in our benefit. I'm saying, we have all these calls, like, intensified. I can't imagine a town that small with no access to the highway, no real major, like 102 going through it, very few and small 55 pluses, and there is, I don't believe there are any nursing facilities there. There's no hospital. There's no any of that pressure that we get over there. So that's a positive, I think, for this. The other thing is, Phil, when you were talking about the differences between, and I'm an idiot when it comes to this, step 4 to step 1 to step 2.
I was going to be like,
No,
I
me.
apologize.
No, me. I just don't.
Yes.
It's not my world. But it would be good if you could explain the actual dollar amounts. Like, step 1 is, I don't know, X amount of money. Step 2, step 3.
Give me a
so you
couple
can see
minutes.
the difference in the cost, because I think that would help people understand that thing that you laid out, with the profit. I think that that's kind of an important thing. And I do want to reiterate in the contracts, I think Cheatham said it. As long as we put in there and are upfront to the employees that this could just be a 3-year gig, which I'm hoping it's not. But you know what I'm saying? I think if we're upfront with people and they take that job, knowing that this is only 3 years, or could be only 3 years, that kind of, it's not blindsiding them, which is what I had spoke about last week or last council meeting. The other thing is, I think that people might be questioning is, because you said they were a lower level, how much is that training going to cost? That's the only other variable, I think, that wasn't mentioned to get them to move forward.
Well, so in the state of New Hampshire, to get hired, you have to have firefighter 1 and you have to have EMT, right? In order to get hired at a basis. Most of the firefighters we are hiring have firefighter 1. and firefighter 2. Firefighter 2 is the highest level entry qualification training you can get, right?
Okay.
And your EMS certification already. So they're already coming in the door with the baseline training. Unlike law enforcement where they, and I believe in their contract it's set up this way, they have like an entry level position and then they have like it's like a non-trained position within their contract, and then they send them to the police academy.
Okay.
We don't do that.
Okay, so the steps are purely time or seniority or
They're
experience?
They're time. And so I have that
Okay.
right here to answer your question.
Okay, that'd be wonderful. Thank you.
A step 4 firefighter-paramedic, it makes $30, currently in the contract, makes $30.57 an hour. A step 1 firefighter-paramedic, so let's just say we got a paramedic who has not worked anywhere in a fire service coming at step 1, they would come in at $26.85. The evaluation you saw was based off of the $30.57. The reality is we're hiring firefighters at step 1, or for instance, a firefighter we hired today who came to us from another community, he started at step 2, but a step 1 firefighter is $22.93 versus $30.57, which is what the chief evaluated up there.
I just think those numbers
That's
and
based
that
off the union
is important.
contract.
Phil, did you say 26 or 22? I thought you said 2685 for step 1.
No, $22.93 is a step 1 firefighter. A step 1 firefighter paramedic is $26.85.
That's a big difference.
That's the difference in holding that paramedic certification, because that education and time frame takes a long time to get, and it's a much higher level of education. So to break that back down, a step 1 firefighter is $22.93. Let's just say we bring in and we've hired a few firefighters from other communities who have 1 or 2 years. Maybe they come in at step 2 firefighter or step 3. That's $24.93. Or a step 3 firefighter is $26.43. We hire a step 1 firefighter paramedic, that's $26.85. Again, the evaluation was based off of $30.57 an hour.
Right, so it's like $8 to $10, right? Variation in there. And I mean, it sounds like nothing, but
When you
over
add it-
time,
you
it,
add it
it,
up,
it adds
Add that
up.
over time,
But
it
I
is.
just kind of wanted to put that number out so we all knew what it was and the residents know what it is. But I do think comparing towns is huge, because we are, to me, we're almost a city to the way we function. And, Litchfield is still that lazy, lucky guys, that lazy little,
But Deb, they have Mel's Funway. We don't.
I do have Mel's Fund.
Sean, I know that.
That's cool.
well, but it's still a nice, lazy
know what you're
town.
saying.
I mean,
It's a
I would
beautiful
assume that the
bedroom
traffic
community.
level that is nothing compared to what we experience.
You drive through it, and it's a farming community still. You look at it, and there's still it's a large farming community.
So I'm just thinking, like if this was us funding Hudson, like helping Hudson, like I would be concerned, because Lowell Road's a nightmare. That whole it's traffic. It's they've got all the high density and stuff just like us. We couldn't. To me, I would be apprehensive if it was Hudson. But this is a nice, easy community, and I don't know. I'm for this because I know our needs are growing, and we need to have these guys trained to your level over the next couple of years as we continue to grow. We know that our population in the next 5 years is probably going to be 32, 33,000 easily, maybe 33, somewhere in there, and that's a lot. That is a real lot. So we have to think of everything we can do to staff you guys.
I can say, as one member of the department who's been here just under 20 years, when I came to this department as a firefighter paramedic, we had recently, within 10 years or so, started our own ambulance. And when I started with the department, we were growing. We were, our ambulance service was still fresh and new, and and to look where it is today, and to look at how humbling it is to have a community approach us and to ask to share in what we've grown and what we've built. It's very humbling, and it's a testament to all of you and people who have sat in your seats before. The investment in our organization, and I can confidently sit here and tell you that we are one of the more premier, probably from where I sit, the most premier fire and EMS agency in the state of New Hampshire, and our firefighters and paramedics provide unbelievable care. some of the highest level of care in the state of New Hampshire, and we're proud of that. And I think that this is an excellent collaboration between our two communities that will have mutual benefits to both communities moving forward.
You good there?
I mean, I'm good.
Ted, go ahead.
I guess going back to the staffing and salaries, did you guys have projections what it would be of hiring a step 1 or step 2 compared to the step 4?
Like the dollars?
Yes.
So again, a step 1, if so, based on our hiring over the last few years, we're usually hiring step 1 or step 2 firefighters.
Right.
Right.
But I
That's-
guess did you do these calculations out with the step 1 or step 2 compared to the step 4?
I did not physically do that. My whole intention of this was setting sort of worst-case scenario for you, and anything different from what we proposed is only in a positive light for our town, not a negative.
we can
Right. I guess I'm just trying to look at the reality.
Mm-hmm.
If we're hiring step 1 or step 2, I'd rather see the reality compared to the
we can
worst
certainly
case
do
scenario.
that for you, based on what we've seen for hiring within the department.
Right. I mean, I'd like to see the reality of. I mean, the shift is a 12-hour shift, right?
A regular tour on a battalion is 24 hours.
24 hours. Thank you.
Yes.
But as the chief stated, some of that timing of work comes down to union negotiations.
So that $30 an hour person compared to the $26.85 person, that's a savings of $90 a day for that shift.
Correct.
That starts to add up after a while.
It does quite a bit. And just for a quick reference off the top of my head, variances between step to step is like about between $4,000 and $5,000 per step. So if you're looking at reducing that by a couple of steps, that's $10,000 per person. It could be $40,000 less than what we proposed here.
Right.
If we get a candidate that comes in that doesn't have a family plan, realistically, what's happened in many cases recently, we're hiring very young people who stay on their parents' insurance until their mid-20s. There's almost $50,000 in savings right there. So I just want to show that there's so much potential for this to be better than what it looks like, but I wanted you to be able to see if all the stars aligned and it was a perfect world and we hired experienced paramedics that all had families, that's what it's going to look like. But in reality, it's probably going to look much more favorable for us.
I think if we could potentially see those numbers, I think it would be helpful
We
to
cannot
see what our.
accurately predict exactly what the candidate.
No, of
pool
course
is going
not.
to
But
look
I mean,
like.
it would be nice to see what our
We could
our
certainly
potential
break it
realities
down
are.
from like a firefighter step 1 or a firefighter step 2 or a firefighter-paramedic step 1. It could be played out that way.
Dan, do you have anything?
Yeah.
Go ahead, Ron.
Go ahead, Dan.
No, I'll wait. You got a list. I don't have a list. Well, so I'll start off by saying that I want us to be a good neighbor, okay? Litchfield's been good to us. We want to be good neighbors. But I think as the chair and as the member of the town council, we have to protect our Londonderry taxpayers, okay? So I think I'm not trying to make a profit off of Litchfield, but I think that there's not enough money in the current agreement that I see from my experience of looking at the numbers to cover all of our expenses. I'm concerned that in the end of the contract, like say in years 2 and 3, we're going to be subsidizing this contract as a taxpayers here in Londonderry. I spent a lot of time with Hudson officials, with their chair and with some other people there, and they're currently subsidizing Litchfield. The amount they get isn't enough to cover the expenses, so their taxpayers are currently subsidizing Litchfield. I am not opposed to this agreement at all. I would just like to see more money in it so that Londonderry taxpayers protected, or some kind of equation in the thing that says that if we get to a point where X happens, Y is initiated so that we're protected. I don't want to get to a point where the Londonderry taxpayers are coming to us and saying, why are we subsidizing this deal that you said was going to be great for us? I drive through Litchfield every day. It is a wonderful community. It's beautiful. But they're also growing. You know, they've got a gas station going in now. You know, they've got new pizza restaurants. They've got a whole bunch of new developments in their you know, in their area. So, who's to say in the next 3 years they don't have, you know, urgent care come to their community or something of that sort? I just would like to see us protected. I think it's great. I want to work with our neighbor. I personally just feel like we need to protect the taxpayer. And I don't think there's enough in this to do it for us to make sure we can protect the taxpayer and make sure that we don't subsidize it in the end. That's where I'm at. Did you want to add anything, Dan?
Yeah. So, I don't know how many of you sat down with the chief. I actually went down, sat down with our chief, got numbers, see what kind of call volume Litchfield was had for Hudson. And I found it interesting that it's actually pretty low compared to what Chief is predicting. I heard that the numbers don't work. I haven't had anybody show me the numbers don't work. What I do look at is Hudson's contract right now. Yeah, I guess for them, they probably are subsidizing it because they're a lot lower than what we would be. So I think I look at the entire thing and people say, well, shouldn't this be on a warrant article since we're hiring people? When we took on the airport, that wasn't a warrant article. The council made that decision. The council went along with having the fire department dispatch for 2 other communities. And I know I've listened tonight, the concern about dispatch. You know, we're putting them on more strain on dispatch. When this was done for the other communities, that money should have gone to the fire department, not in the general fund. Should have gone to the fire department to hire personnel that you need. That was a mistake. So, you know, I listened to comments about, you know, you guys have been asked to look outside the box. And prior to you coming here, Chief, they did look outside the box. They came in. I wasn't on the council at the time. They came in and they said, we can secure 2 fire trucks now at this price for down the road. That's thinking out of the box. We all know that Londonderry Fire Department needs staffing. You look at that MRI report, it will tell you we need staffing. We need staffing on dispatch. So we're going for a safer grant now where if we get it down the road, and Chairman Dunn, you voted against it because you had a good point. It's going to be a big hit for the taxpayers down the road. I look at this, and I've done my homework. As a business person, I look at it and go, does this make sense? Yeah, we're only going to get $1,000 some odd dollars? That doesn't make any sense. Yeah, it does, because we're actually hiring 4 extra firefighters, which are going to be on an ambulance, and they'll be used in this community 80% of the time. Only 20% probably going to Litchfield. We're going to have a dispatcher. Not money going into the general fund. We're going to hire a dispatcher to help dispatch. So when I was in there this morning, I happened to stop in at the fire station. I happened to see an ambulance going up Mammoth Road onto Litchfield Road. When I was in there, they told me that we had an ambulance go to Litchfield. I'm like, why do we have an ambulance going to Litchfield? Oh, RSI. We had an RSI there. And I guess you guys had another one in Derry today or something?
We did.
And I'm like, what's an RSI? Tell me. Educate me. All right? So Phil explained it. You know, he says basically, Dan, we are trained to be able to put a tube down somebody's throat so they can breathe.
Paralyze them and put a tube
Right.
down their throat. I just want to.
So I went
We
to my.
give the medication to go to sleep.
Yeah,
too.
let's.
It-
Yeah.
Well, I know there's a
con-
lot to
it's
it
one of
because
the- so
I-
Like in an operating room, we put you to sleep. We give you medications. We put a tube in your throat.
we have to get certain licensing from the state
I'll
to be able
sleep
to do
better,
it.
thank you.
so
Correct, Sean.
We don't just take people off the side of the road and
so
paralyze them.
so basically I went home and I said to my wife, who's a nurse, and I said, you know, I didn't know our fire department did RSI. She goes, they do? She goes, that's very technical. You know, you need really good training to do this. And she went into the whole thing about the medication and everything else, how you do it and all that. And I have to tell you how impressed I am with our fire department. And if I was in Litchfield, I'd want those men and women over there too, taking care of my people. So the more I looked at it and the more I crunched the numbers, and I know there's not a lot there, $1,000 some odd dollars, but I also look at what the fire chief did and his staff. When he first came here, and I talked to him about this, he was quick to say, I don't know if this is going to work. Now, his predecessor had already had people on his staff look at this as well. Chief Young didn't want to look at those numbers. I want to be independent. I want to go in and look at my own numbers. And they both came up pretty much that, yeah, Londonderry can do this. And it will benefit Londonderry. So I think this is a good thing. I know that it was the same concern when we took on the airport. We had to hire 25 people, and they said, oh, my goodness, what happens in 3 years if this contract gets, canceled and they go with somebody else? Everybody was told, we're hiring you, and at the end of 3 years, you might be gone. I've seen the decrease at the airport from when we originally took it. We had a lot more staff, a lot more personnel up there. With time, because airlines have, left and everything else, the numbers have come down. We've never laid off anybody. What we've done is we've looked at people like Bruce has got 20 years, and he's leaving, so you don't fill that position. You move the person in
not really
and slide them down.
Not that I'm aware of
He's
any.
got too many. Got too many investments.
But through attrition, people leave.
I'll sleep better.
So
I don't have enough gray hair yet.
Hey,
Give it time.
So the more I look at this, I think this is something we should pursue. It'd be nice if we had taken the money originally from Hampstead and put that towards staffing. But this, with Litchfield, we are going to add a dispatcher. We're going to help them. We're going to add 4 more people on our fire department, which is huge, which we need. And it's not like Litchfield is saying, all right, we're going to give you this money. We want you to staff this ambulance, leave it parked here at our fire station. Nope, it's going to stay in Londonderry. and it's going to be out here helping our residents. That's my 2 cents.
Ron,
Yeah.
before you go, I just
Oh,
want
yeah.
to, excuse me, make a comment on what you were saying about Hudson. So Hudson realized that they undercharged Litchfield, and basically, yeah, they don't want us to take it because they want it back, because they know they're going to make money on it. And I'm sorry, they made a mistake. That's not my problem. That's Hudson's problem. And the other thing is, we have a 6-month, did you say 6 months or 9 months out?
6 months.
6 months, if it's not working and we don't see those numbers be where we need them to be at, guess what? We can walk away. So I just wanted to reiterate to answer what you were saying or address what you were saying.
Sure.
Can I make a statement?
Absolutely.
So
Ooh, I
to
shouldn't have said that.
address the subsidy that you whoever brought up about Hudson, that we're subsidizing, I'm sorry. Prior to me becoming the fire chief, there was a 10-year period where Hudson never went and redid a contract with us. So for over a 10-year period, we were at a fixed rate with Hudson. And then when I became fire chief, Hudson realized that they had never redone our contract. So we were, in fact, doing well off of Hudson because they weren't charging us a lot. So back in 2023, we came up with a new 3-year contract, but because of our tax cap, they couldn't really bring the price up. So just to throw some numbers out, we were in the 67,000 range back in the 2020s. Then we jumped in 2023 to like 74,000 for ambulance service. And we're now up to $121,000 this year. So yes, there was they weren't making a lot of money, but we've been slowly making up for it. And now we're talking about a 64% increase for us to go from where we are right now to a service with Londonderry. So you won't be subsidizing the town of Litchfield because we've been making huge forward steps in what we're paying for our ambulance service. I just wanted to make sure you guys were aware of that.
Okay.
Chairman Dunn, I'd like to say one thing too.
Please.
And I don't know if I'm speaking as a deputy fire chief or Phil, who lives at 3 King John Drive, but I'm going to say this: I've lived in this town since 1993. I went to South School. I went to the middle school. I went to the high school. I owned a house on Reed Street. I own a house on King John Drive. I have friends whose parents live in this town. Ted's parents live in this town, and I've known Ted's parents since I was little. Ted and I have lived here almost the same amount of time. I have parents and their parents of my children's friends that live in this town. I wouldn't look into doing something if it was detrimental to our town, because I've invested far too much of my life in the town of Londonderry to do something because it's something, all right? And I've said this all along. We're not going to do something that doesn't benefit us. And I'm speaking from me because, I'm going to retire at some point in the near future. I have a lot invested in this community. I've been through every step of it. I've played on every soccer sports team that this town has. My kids do the same thing, right? I'm not going to sit up here and do something that's detrimental to the people I care about, the people I grew up with and their families that still live here, right? That we still go on calls to. I wouldn't do that. Wouldn't do that to them. So I'm going to speak as Phil LeBlanc from 3 King John Drive, who's lived in this town since 1993, that I would never do something that is not of benefit to this community, because I've had far too much invested in it, and I'm not leaving anytime soon, because like Carter, who's at bed because it's 11 o'clock, doesn't graduate for another 10 years. So I just want to make
And
that
Phil,
statement.
I am in no way implying that you are.
I know, Ron. I know,
I'm taking a different look at it.
Sure.
That's all. I'm not implying that at all. You guys do wonderful work, and I know that your heart is in it. That is not where I'm coming from.
I just
Okay,
want
so
I just want
you
it
know
to
that
be known
that is not
the
that is not my
investment,
intention.
The decision
Yeah.
that we made, and when he came to me and asked me
Yeah.
about this, was done with the understanding that this is only for the benefit of this community and the people that live here. and the men and women that work here. Because honestly, if it's a benefit for our community but not for the men and women who work here, it's also not a benefit.
Right.
Because they also have families in this town, right? And in Litchfield, for that matter. So,
And Phil, you know that I support you guys, all right? I'm just looking at it from a different lens. I put a lot of time into this, look into it. I'm one counselor up here looking at it a different way. So I think decisions like this are normally sent to the voters. We don't have that opportunity here. Thus, I think maybe the best method to move forward tonight would be to schedule a public hearing on September 14th so that we can hear from the public, because we haven't heard from the public. You know, I've heard from people in the residents come to me and talk to me at Old Home Day, and everybody coming up to talk to me and calling me on the phone. I must have had over 20 firefighters call me. I think we need to hear from the public. You know, if the public says they want it, let's give them time for all parties to come in also and review the numbers and look at maybe there is a little bit more money we can put towards it. Because I'm not opposed to it. I don't want to vote no. I'm looking at it as with an eye for the numbers and saying that I just see a hole here. I see a problem here. You know, I heard from many residents, especially at Home Day. I must have talked to over 50 people. Many of them were taxpayers that never heard of this until Saturday. They were on vacation, out of town, whatever, knew nothing about this. And whatever side they were on, they were like, I'd like to know more about it. So maybe it's in our best interest to have a public hearing on this, let the public weigh in, hear from everybody. It gives us time to discuss with Litchfield if there's any room to put some more money in the contract, whatever, to make us all feel happy. Like I said, I'm one counselor. I'm just suggesting that. Old Home Day was it was a great event, but so many people approached me that never heard of this and they wanted more information. They had concerns about it. Some of them were in favor of it. I talked to, several people that, were trying to convince me otherwise. So I just think maybe as a council, if we hear from more people and give it time to massage some of the numbers, maybe it works. I'm one person, just suggested maybe we give it time to do a little more research and get everyone on board, because I do not want to vote no on this. I want to support Litchfield. I want to be a good neighbor. I want to support the fire department. I just have concerns that I see in there, and that's where I'm at.
I mean, I guess on that front, I mean, I've received calls all day. I'll say fundamentally, like, this is awesome. Like, we can get more firefighters. We can address the needs of this community. We can, expand our service with more minimal cost to the taxpayers, looking at the numbers. My gut feeling right now is like, I'm slightly on the yes side, but sometimes when you approve a deal, and you approve a deal that could affect this community for 10 years plus, you want to be enthusiastically like, yeah. Like I said, I'm like thinking in my head what to do. You've answered our questions really well. I guess I would like to see them go back to the table of Litchfield, make this a little better, and come back to us and give us an opportunity at the public hearing, because all day long on the phone, there's people who also they wanted to weigh in on this, and it's like split on what I'm hearing, and I don't like that. I'd rather have the community enthusiastically embrace this, have no heartburn, because the problem is, even if it works out on paper, when half the community has heartburn in 3 years, if something goes wrong, that's going to turn into 75% of why the hell did you do this. I'd rather have everybody feel good and be on board, and have numbers that feel that way and feel good.
Chairman Dunn, may I
Absolutely,
make
please.
a couple of comments? I just wanted to address one particular comment
Yeah, please.
for you about the fear of subsidizing this contract with Londonderry tax dollars. I just want you to know from my mouth that a great deal of thought went into preventing that from happening. I am a very fiscally conservative person, and I always take that into consideration, that it has to benefit the community, who is the host community, if you will, who is handling or responsible for all of the overhead, the staffing, the licensure, et cetera, et cetera. So a great deal of thought went into preventing that from happening, and that's why you have escalators both within the intermunicipal agreement as well as the ones we have less control over, but they still are escalators within the ambulance billing, as those will increase over time to cover the cost of government, as we're all aware, continues to increase with contracts and the cost of goods and services, et cetera. So all that is thought about to protect the taxpayers from subsidizing this contract over a long period of time. And again, we will historically look at call volumes. If there happens to be a large increase in population in the town of Litchfield, we look at that, and we have the option to withdraw or renegotiate that contract to be able to account for those additional costs. I know Litchfield will sit at the table with us and have those discussions. I would like some guidance from the council as to exactly what you're looking for. As I hear, make it a little better. What is better? Please define that. Because what we've looked at already is showing that this covers the expenses. So now we're getting into that portion of profit, which is not being a responsible good neighbor. But we have demonstrated through data and showing that more than likely this is going to be better than what we've proposed in a net positive for our community. So to just say, make it a little better, I have no idea what that means.
And I think that's completely fair. I'm trying to think of the mechanism for it, but for me personally, I mean, if it's okay with everybody else, I'd look through it, dig deep, and go, what could I think could be better, and give you very exact specifics, if that would be preferable, if that's the kind of guidance you want, because I think it's completely unfair to go make it better. I'm just trying to do it in a mechanism that works, that doesn't feel too disruptive to what everybody's doing, but I'd have no issue with that if that's what you'd like.
I just don't want to think about something from my perspective and it's totally opposite what you're looking for, and we're both working in opposite directions. That's a waste of everybody's
And
time.
when we're presenting something that is a net positive and you're looking for better, and this is just, like you said,
Better's
you have
a
to dig
nebulous
into
word.
it. What is that when we're already presenting you something that is better, right? And you can say, and the chief explained very clearly the reason for the subsidies, and I'm going to say it, shame on Hudson for going 10 years without renegotiating a contract. That's their fault. We don't operate that way. We haven't operated that way with our contracts with Hampstead and Pelham, and I can show you all of our contracts with them. We don't operate that way. So if that's your concern, that's their fiscal mismanagement, not ours. That's how it is.
Mr.
Sorry,
Chair,
that's
I think coming back and presenting some of the numbers that maybe we had spoken about earlier about the step one and step twos, and what those expenses would be against our modeling right now, and seeing where does that have us land. I think that might maybe present a different picture for the other counselors. So,
And I believe one of the counselors mentioned something about a concern about a nursing home or an urgent care or something like that, something that would have some type of substantial call volume impact on the Litchfield ambulance contract. Would there be, are you looking for like some language where if something like that was proposed, that it would have to come forward, I guess to the chief's point, like is quarterly or, bi-monthly business reviews where we present all the information, calls to Litchfield, is that something that you're looking for? Like, are you looking for us to show a way that to you and also to the taxpayers that this is a net deal to Londonderry? Or, because I think to the chief's point, if we don't want to make it so that we're harming Litchfield at our our revenue expense, right? We want to be a good neighbor. We want to give them the service that our neighbors are asking for, but we also want to do it that's both responsible to Londonderry but responsible to Litchfield. So I think we're looking for some tangible things that would help enhance the contract for the board's concerns, but also making sure that we're working within the confines of making a successful deal.
I think I can answer that. So when me and John Farrell negotiated the contract with the proposed mental hospital facility, one of the giant concerns on that was call volume. and worried about if that was going to overwhelm this community with service needs far beyond what we were going to get. And so the call volume makes sense, although this is a very specific type of call. So I'm trying to walk through and think about how that would work, because we were looking then at a combination between police and fire calls where we're not dealing with police calls at all, and yours are of a different nature. So something towards that degree, I was more preferable to that. Where that deal fell apart at the end is when they pulled back completely away from call volume and go, we're going to give you a lump sum of money, take it. Then I'm like, okay, that doesn't significantly cover this community. So that gives you kind of an idea of an instance of what I was thinking at that time when I was looking at a deal.
And I think to that point that you just mentioned, this deal, in reality, cover your ears. The risk to Londonderry is fairly minimal because, and I know we don't want to talk about this, but let's say we get to end of year one of the contract and it's just not favorable for the town of Londonderry. God forbid. We would lay off 4 firefighters and a dispatcher, right? We're just talking hypotheticals here.
Yeah.
But that doesn't really harm Londonderry as bad as it harms Litchfield, because Litchfield would then be left with
Nothing.
who do they go to? Do they go back to Hudson? Well, so really, we're in a very favorable negotiation period, but also we don't want to be unfair, right? And so it's kind of this, like, we're trying to make it so that it's favorable to Londonderry, but also we don't want to go so far the other way that it's unfavorable to one community. And at the end of the day, I as I've spoken with all of you privately, I understand the concern of making sure that we're protecting the citizens of Londonderry. And that's why we've gone into such great detail of making sure that the costs are high and the revenues are modest, so that we can show that even in what we consider to be a worst case scenario, it's still favorable to Londonderry.
So to that point, and I'll use this as an example, and I'll try not to get too deep in it because, again, we're negotiating a deal. So when I think about deals like this, the one thing I think that they would want, that I think is favorable to both sides to provide, is security in the deal. So the ability to get out of this in 6 months, well, that's nice in its flexibility. I don't know that that benefits either side. In the end of the day, we've got 5 people that we've got to tell, well, sorry, and they've got to go on the search and the hunt again. I think to have a better financial solid deal with more security gives them the benefit of they're not going to be, because I don't think you want to be sitting here a year from now going, shoot, what am I going to do now? You know, but it's solid. It makes that deal solid on our side. And those are the kind of give and takes in deals that you.
I think the thing that's lost here, though, because you just said it, you want there to be financial security. The majority of the security that comes in this deal is the service we provide them. It's not the money. Because if they're not going to walk away after 3 years if we're providing them a good service, right? So the security is in what we provide in service. That's it. It's a service-based, if we're talking business, it's a service-based contract. We are providing a service to them. They are paying us for it. If we provide poor service, they walk away after 3 years. It's incumbent on us to give the taxpayers of Litchfield what we give the taxpayers of Londonderry, which is excellent service. And after 3 years, if we're giving them excellent service, then we renegotiate again. And maybe after 3 years, we can't come to a number that is, but the service is what keeps this contract, not the dollars. As long as the dollars cover the costs, so that we're not subsidizing, to Ron's point, the service is what drives this.
I think
both
that
towns.
the last thing I'll add, and just to try to give you more specifics, because I think that was a super fair question. I too had talked to people in Hudson that work in on the select board and on the budget committee, and other people, and people I know good enough relationship to come to my house. I'm sure they're not just making up stuff to me. I want to see this deal get closer to them. I know these two said that Hudson was ready to walk away from the deal. That's not what they really said to me about the deal. They said that they looked at ours and they were comparing between ours and theirs, and they said, ours looked better for Litchfield. So they've been comparing this for a while. So I guess from what their deal is, I'd like to see it get a little closer to that in the end of the day. that would be another good general guidance.
So you're talking money.
Yeah, if,
It's all about the money for him.
can we ever have
That's what it is. I just want to make sure that that's what your people
Deb.
No, it's not
understand.
all about the money.
Deb, it's about protecting the taxpayer. So if we can put something in the
Don't even
contract.
go there, Ron, with the legal stuff. You're not protecting the taxpayer there, but you're protecting them here. Pick and
Can we
choose.
knock off the
Okay.
rails?
Deb.
Sean, just shut your mouth for a second. You know what?
Deb,
Here's the deal. Do not talk to me. Yes. Oh, I didn't go to kindergarten. I went right to first grade. Anyway, go ahead.
no, I think
I'm that old.
also,
Show respect.
no, I think also, to Sean's point, if we could put some kind of thing in the contract that would, I guess, I'm not looking to make a profit, as you guys say. That's not what we're looking to do. I'm looking to protect the taxpayer. So even if there was like a thing in there where, hey, we made this much money, well, we do this. If we're this much under, we do this. Like, just something that protects us.
You need to define that. You can't just say that.
I think Sean did a good job of defining
He
it.
didn't. He just said, basically what he said is we want to do what Hudson did, which was more money, get to the same level as them. That's more money. So if that's what you're looking for, just actually say to these people up front and straight, you know what? We want the same dollar for our
Yeah.
services
Let me
that
just say-
Hudson's getting.
But Deb, didn't I say that in my statement? I mean, I'm just saying. So,
Right, and I know that, the selectman over there wants it. He's a developer, I know who you're talking about. I watch their meetings, I cover their meetings. So I just think we should be honest with everybody. You want it, public come in? Give the public all the information right now. They're looking for the same deal that
not looking for the
Hudson
same
was
deal.
offering you.
go ahead.
That's what they want here. So
I'll
if
wait
you
for it
want
to be done.
Londonderry service, just ask for that amount of
Deb.
money with them.
Deb, can we have a conversation without
I
just?
did, I'm going to the bathroom.
Okay.
Whatever.
I saw your hand. I saw.
Oh,
I saw Dan's.
I think what I would like, Chief, is that I know you've said 600 some odd calls is what you're looking at.
Yeah, it was based on 620.
620. Maybe have something in the contract that says if we get to a point of X, let's say, just for discussion, 680, we need to revisit.
Well, and I think on the other end of that is if we're falling below too many calls and we're not making the revenue end of it to justify the men and women, I think that
Mission-based might be better than time-based. I
Right.
think that was a
Yeah.
good point there. Just to reiterate, it's not all about the money. In the end of the day, we talked about several conditions that aren't money-related. It's just trying to make sure that this is something that works for the taxpayers of our community, who we are responsible for first and foremost. And we do want to be a good partner to Litchfield on top of it. There's a lot of factors in that.
I think Bruce brought up a good point earlier of if we could have quarterly updates upon the call volume and the potential insurance payback for the calls. I think that would be helpful for us going forward, obviously starting in January. I think that would be helpful for us to know and seeing that this is a good financial plan for us going forward, that we did make a good decision, if that's able to be done.
It's in the agreement already.
Thank you.
I'm very familiar with that process too. We did it annually, but of course we could set it to whatever frequency that the council desires for
We have
updates.
it quarterly in the agreement.
Perfect. A couple of concerns that I have, again, if I may speak,
Please,
I'll
this is
try
why
to
we're
keep
here.
it brief. The town of Litchfield does need an ambulance service come January 1, so that is part of this entire discussion. And by words, I forget which councilor it was, I apologize, there were already concerns from the council about the timeline between now and the process that we need to undertake to hire people, make sure they're on staff January 1, et cetera. When the longer this gets delayed, the decision gets delayed on it, the shorter that timeline becomes. So we would like to make progress on this as soon as possible. Again, I will say that we tried to address the concerns of the citizens. I know I addressed the concerns, many of the concerns that you brought up. not necessarily with public input directly, but thinking from their perspective as a taxpayer, which I like to do when I formulate these proposals and take everything into consideration. I just wanted you to have that information. I would always caution, too, about an entity that tells you something is such a bad deal, but then wants to talk you out of taking it from them. That's a very legitimate concern, and I just want to raise that
I would
point here
also,
tonight.
and I would also mention that sometimes there are people who price themselves out of things for a reason because they don't want to do it anymore. That happens all the time. So there could be evaluations that looked great, and that could be because they knew that there's a tax cap and they could price themselves out of something.
So let me ask my question again to the council, to anybody. I don't want to vote no on this. I want to vote yes. I think you guys are wonderful. You guys do a great job. All right. I think we should have a public hearing on this on September 14th, hear from the public. In the meantime, we work on a few things here and there to try to do a few things to tweak it a little bit so it has a better presentation and, you know, more protection for the taxpayer. It could just be some kind of variable in there that if we get to this point, we do this. If we get to this point, we do this. Just something there that protects the taxpayer so we don't ever have to subsidize it. And I guess I don't see the harm in hearing from public and hearing from other people. And there was a lot of people that approached me that said they knew nothing about this. They were out of town on vacation, whatever, and knew nothing about this, and they wanted to weigh in, and they haven't had an opportunity.
Mr. Chair,
Please.
would the board entertain providing the fire department and town administration with a vote on the perspective of moving forward with the agreement, with the idea of a public hearing on the actual legalese of the contract? Because I think what I've heard from all of you tonight and then speaking with you individually is the premise behind the idea is good.
Mm-hmm.
The idea of collecting revenue and hiring more firefighters, it's got all the different pieces, but I think what we're within, and we talked about business, is we're also a municipality and we do our business in public. And so I think that we need to give our neighbors, yes, we're willing to walk down this road with you, but as the chief indicated, it's the end of August. We're talking about a public hearing in September. They have their budget. We have a tremendous amount of work to do from now until December 31st.
And to Ted's point, if we push this too far and we get into the hiring past January 1st, then yes, there's going to be cost affected in the current budget that we are going to eat because we push this down the road too far. Because I can hire people in 8 weeks but we're also coming into Christmas and New Year's and Thanksgiving, and that all comes into play with it because there are factors in the hiring process that are outside of our control. So just keep that in mind. September 14th turns into October 1st on a contract, and now we're 2 months out from
You can hold a special meeting.
I also think that your point, Mr. Chair, is an excellent one, that, you know, it's important to receive public input, and you're correct. I know that myself as a taxpayer, I've entrusted each one of you with my vote to represent the constituencies of this community. And I think that the idea of walking this down the road between us and Litchfield over the next couple of months, while we massage all the minutia of the details, if you will, is an important one that kind of happens, you know, as all the parties come together. But I think what we really need to know is, you know, do we have the council support to invest in this partnership? Because if it's not a favorable partnership, or the council doesn't see the value in this moving forward, then I think the best thing is to not, you know, for us to let Litchfield find an alternative, because I think if we truly want to be the neighbor that I know we are, we've got a lot of work to do between now and December 31st, and I think that's the premise of our. we're not trying to rush
Yeah,
by any
no,
means, but we
I-
want to make sure we have the right amount of
I
time.
think those are fair comments, and I think with full intention, you know, we intend to take action on the next meeting, because we know this is, one, we're bad if we go any farther than that. It's bad for them if they go any farther than that. It does put us in a best and final offer type scenario, but I also, the biggest heartburn about this entire thing, and I feel like as a council, we're drifting towards this pattern, and I do not like it. Spending large expenditures that involve staff without going to the ballot. I know the timing of this is why. I know it's a good deal, and I know it's why, but what would alleviate some of that for me is at least giving the public an opportunity to speak in a public hearing.
Deb.
Solution, maybe? You can have a special public hearing, which would be nice, because, look, we're doing this now. This room was filled. People who wanted to say stuff, they left because it's so late.
Yep.
So you could, next week, next Monday, have a public meeting just for this, so that that would satisfy you guys. Then you could make your decision either that night or the next meeting. And I think that at least pushes it along quicker, and it doesn't drag these guys over here over and over again, and it just puts it to bed. And
That's a good suggestion. The timing doesn't work for having a meeting next week. Our manager's on vacation. I'm not here. So, but I think we can.
Well, Kristen
How
can
much
run the
notice
meeting.
do we need for a public hearing?
24 hours.
24 hours?
Yeah, you do it
Why
this
can't we do it this week?
Because 2 days certainly
We
isn't
need to
enough.
give. We need to give
yeah.
time to put some things in the contract and work it out. And I don't know about you, but
Yeah.
anything rushed just seems like it's
It's a bad-
it's a
it's a
bad
bad
mistake
thing.
in the end.
That's why I didn't know if it.
Yeah.
I,
Yeah,
I
yeah.
was just talking off the cuff,
Yeah.
but I didn't know if it was possible for
mean-
the council to give approval for the negotiation of the contract, knowing that
I think unfortunately, if you push it back the way you were talking about pushing it back, you were really pushing up against spending taxpayers' dollars out of the current contract for this, should you vote it in, when there's not supposed to be that. But that's a decision that you
Yeah,
can make.
and then I will say, and well unfortunate, you know, this has started since April, and I've been saying on all these negotiated things that are put in front of us, that it's better to involve us early so we don't get into these situations. There's been a lot of work on this, and I think we could have had some of the same input we provided you tonight months ago, and that could have happened, and I'm not blaming anyone on that, but I'm saying we are where we are, and I think we do need that extra time to make sure that we get the little last details right, that we have the public involvement so that we feel good about this is a community decision, not just a council decision.
Mr. Chair.
Mr. Chair, I have a comment on that as well.
Ted, and then you. Ted.
You were saying earlier about salaries. Do you know what a full year salary is for a step one, step two? Is it about 64?
Pull it back up. Give me 1 second, Ted.
Because I divided the four salary positions by four, and it got to like 69,000. If that was the top rate.
Ballpark, yeah.
So is it like about 64 for the step two-ish?
we're using 42 or 48 hours. Or 40.
I was just dividing it by four for the number of people.
Oh, I got you. You took the total amount of
The,
salary.
the 276, 581 divided by 4 came to like 69,000. Just wondering about our step two-ish people, if it's about
So
64-ish.
what step, Ted?
Step two?
Step two, firefighter or firefighter-paramedic?
Firefighter-paramedic. Because
Step
if
two,
we're going to be having them
firefighter-paramedic is,
potentially
is-
using the ambulance, they got to be a
Yep.
paramedic, right?
No, EMTs, advanced EMTs.
Okay.
So, but a step two firefighter-paramedic is 61,719.84.
Oh, okay. Even better.
Sir.
Yeah, I just want to comment on that. This has been going on for a while. I've been keeping the council informed of that. Even as early as this morning, I asked you if you had any questions or concerns, wanted to do anything different. No, we're all set. We're all set. And then here tonight we have all these questions. So I find that troubling when I hear that, when you say that publicly, after repeated meetings, opportunities to ask, hey, listen, what about this? What about that? I even asked you, Chairman Dunn, I said, you told me the numbers don't work. How do they not work? What information can I give you? Tell me how it doesn't work. And then I hear these comments publicly. I find that troubling. That's not how this relationship is supposed to work. We're supposed to be working together. If you have issues of concern, tell us. We'll get you the information that you need. But again, as early as this morning, we had this once again. This seems to be recurring on a frequent basis, and I don't understand why.
May I
Absolutely, go
proceed? Yeah, this morning in the office with you. I don't have these guys here. I don't have these guys here. I don't have the public here to take into account with stuff. The only thing I have is what's said to us in an office, and that's it. This was happening in April. It wasn't happening this morning. You frequently say, oh, we talked to you in the morning, so therefore you've had all the heads up you need on a month-long contract negotiation. That is not significant, it's not good enough, and you can keep saying that over and over and over again, but every single time this comes up, we're gonna have changes, you're gonna give that speech, and people are gonna be frustrated, you're gonna tell us about how the staff time was wasted, all the lawyer bills to get us to this
You're
point.
absolutely right. You're saying it for me.
Councilor Faber, I'm going to say this. I'm going to reiterate what Bruce said, which is we, as a taxpayer, we elect you to make decisions for us on a whole. But we also get paid to be professionals and subject matter experts in this. And at times it does not feel as though there is a trust there, that what we're telling you is the truth, right? So I'm just saying that to you as somebody who sits here, who pours hours and hours and hours into this to then hear that we didn't involve you early enough or that this doesn't make sense. And I get it. You have a heavy weight on your shoulders, the whole town of Londonderry. They voted for you to make those decisions. But from our standpoint, that's the consensus.
I'm glad you said that, and I want to address to you. None of that's remotely accurate to you, to Chief Young, to anyone else here in that aspect. This isn't just a process about firefighters. We've got to take into account the whole town and every aspect of that town. It's also an aspect of the relationship between us and the town manager and how things have been functioning. It has nothing to do with you or faith in you for this job or anything else or any of the other staff on hand. And I want to make that absolutely crystal clear, and I mean that.
Yeah, but as a taxpayer, because I do pay taxes
Yes.
and I vote, part of the democratic process is voting for people to trust them to make decisions. And clearly this town trusts you all. That's why you're sitting there. They trust you all. And so this is an upward stream of trust that starts from the lowest taxpayer voting for you, up through us department heads who you have hired, and the town manager who you have hired, up to you to make these decisions. And to turn them around and go back, it just seems like we're
It's
flowing
not,
back
it's
downhill
just
now.
asking to know about stuff earlier so we can help along in the process. Because if we're going to have a criticism and it comes to you in month 8, it's not fair to you. It's not fair to the people negotiating. Maybe it's a simple thing we would have just thought about and we go, have you thought of this? And you're like, no, totally. And it makes it go in so much of a better direction.
But heavy
We ta-
is the head that wears the crown,
But
unfortunately.
Can I finish, please? Sorry. We talk about transparency. We talk about being open and in front of everybody. But if we are, then we should know, we should at least have some kind of, and maybe we don't need to, because we can't be involved in everything. We're like, you're good, you got it, I don't even need to know, just run forward. But a little bit of oversight sometimes, even 5%, 10%, makes all the difference, and it prevents this situation from happening again. That's all I'm saying.
Chairman Dunn, I wasn't finished.
Oh, please, go ahead.
So, status reports were sent out on April 18th, April 28th, May 19th, June 26th. So the status reports, the documents, and if you had those questions, you could have done like Councilor Bouchard had, and you could have gone to them and asked them, but you didn't do that either. So I'm a little concerned about that. You keep bringing that up when we are willing to provide you the information that if you have those questions, to ask us, and we will get that information, but you have not been doing that. So you want to blame that on the relationship with the manager. You need to look at yourself in the mirror, sir, and find out why that is the case. And you can smile all you want about that, but that's simply what it is. You've known about this for a long time. I'm still talking, if you don't mind.
I asked him if I could speak.
Yeah, let me finish.
You should pick up this book too.
We were told we
Okay,
didn't need
hold
it.
on.
Well, perhaps you could teach the rest of us about that book,
Guys.
sir. Yeah. Anyway, so you've been provided information for a long period of time, and you've been given that opportunity to ask those questions, and you've never done any of those things. When you go to these meetings, you say nothing, almost nothing, which that's not how it's supposed to work. Look, I don't understand this. Can you explain this to me? Can you provide more information? And you're not doing that. You wait till we get here. This is our second meeting on it, and now we're getting some sort of mixed match information that you want us to somehow figure out, which I still don't know what it is, that we're supposed to negotiate with these folks from Litchfield. And it's still unclear to me. I am done, sir.
Okay, good, sir.
It's precisely that kind of behavior why this relationship is broken down between us and the majority of the council. We're trying to get something done here for the community. I'm not raising my voice, doing all those kind of things, some grand production. In the end of the day, all we're asking for is to be let in on early and know an email that I happen to talk to. And you know, this, you want to talk about repeated things. I emailed you. In the work world, the I emailed you isn't good enough. If it's a significant deal that could help us as much as this deal done right could, maybe telling us or going, did you make sure you saw this important bit in the 14, 17 other items in there that were there on top of the other emails? Just going, I email you isn't cover. If you're having negotiations with a town, if you're negotiating contracts in our name, then we should be in on it. It makes sense. We're the approving body. There's no reason why you would not include the approving body early.
So step up to the plate, sir. Where have you been? I've given you that opportunity multiple times. You don't show
I
up.
just want to so Phil, I just want to tell you, this is not anything personal against you, from me. It's more or less, I just see it differently than you do, that's all. And I'm just asking for us to do a little more review.
I
That's
guess my
it.
concern, Ron, is that we've given you the facts.
Mm-hmm.
We've given you the facts, data. We've given you data,
Mm-hmm.
right? It's not numbers that we've pulled out of the air. Ted has asked for more data, which we can provide him.
Yep.
We can provide you those. We've given you data, right? But it doesn't seem like you believe the data, or you believe somebody else's data that they've provided you, and that's the roadblock I'm struggling with. If you could provide us with a tangible, this is how I see the data, this is how I'm coming to my conclusion, this is where I'm getting this information from, these are the numbers that I've plugged in, and this is what I'm getting, and it differs from what you're getting, and we can look at those two things together. I'm all for that. But from our end of it, we're providing you data based on contractual numbers, historical costs, negotiated contracts from other communities, dollars per call, Sean, which is how we figure out dispatch contracts, which we did with Hampstead and Pelham also, dollars based on call per call dollars. That we're giving you that information, right? The chief is providing you that information, and he's providing you in a manner that gives you the highest cost that this would be if we use the highest numbers. Not the lowest and then, oh, we don't know. He's giving you the highest cost based on the data. So again, if you disagree with it, that's fine. We're allowed to disagree. There's nothing wrong with that. That's what allows us to look at the whole picture. I said that to Deb after the last meeting when she had questions. It's good to ask those questions, but we need other factual data from your side coming back to then look at ours and look at yours and go, where is the discrepancy?
Okay. Deb. Oh, it's Deb
So,
first.
I'll be calm and polished and smooth, except not a politician. I know that we get these reports every week, and I check my email all the time, and I read them, and I think there were 4 times that I did not send back to Mr. Mulholland a page of questions on each item that he sent. Either, oh, this is great, could you explain more on this? I don't understand this. Can I have this data? And I get every single thing that I ask for within a day. So what I don't understand is, I did have questions. I sent it to him. He gave me my answers. I got my information. I talked to Phil. I've talked to Bruce. I don't understand how I can do this. You know, the unpolished drama queen, the theatrical person can do this, and this smooth, polished, entitled young man can't seem to find the time to read an email in his counselor emails. And if this is too much work for you, then maybe you should step off. There's a lot of work here. And if you don't want to do the work, there's a lot of work. I stay up late, work Saturdays and Sundays, and I still don't get all the data. But I try my damnedest to make sure that I have everything and I'm ready for these meetings. I wrote 3 pages of questions. I gathered information about things so that I could speak about them. 3 pages. Because so I wouldn't forget while we were talking. That's part of the job. You have to do it. Somebody can't do it for you.
Mr.
And
Chair.
I just think it's wrong.
Go ahead, Dan, and then, Dan, and then.
So, Ron, when I first
I
started on
heard you,
this,
Janet. Please be quiet.
Hey.
Thank you. Don't tell me, hey.
No, but come on. We don't.
Well, it's okay for everybody else you shut up, but she's your friend, so you don't shut her up, fellow Republican. Woo-hoo.
Ron,
Go ahead,
I
Dan.
heard you say
Dan.
drama.
so,
Okay,
please,
please.
I'm trying to speak. So, Ron, when I first started, you always used to say, Dan, you got questions, I always had questions. I've learned that I need to go out and get my questions answered. And you notice tonight, I didn't have a lot of questions because I went out, I spent a lot of time on this. Talked to the chief, one-on-one. Talked with Phil. Talked with Bruce. Talked with people in Hudson. Okay? It takes time. All right? And if I had any questions, also, I go to the town manager and I ask him. Now, you know, whatever issue you have, Councilor Faber, you need to resolve that and try to work with our town manager. I mean, you say, Sean, please. All right. You know, you said we all need to be included. What I find that kind of funny because Deb and I have asked about this whole legal thing to be included, and we don't get included. So this is an issue very important to me. My priority on this whole issue, Londonderry first. All right? That was my first priority. I want to make sure that our people in our community are covered first. The more I dove into this, all right, because there's a lot of work to look into, it takes time. The more I dove into it, I saw that our professionals that we have in Londonderry are going to keep our residents first. And they're, you know, we give them a task of, yes, you're understaffed. You need to come up with some creative ideas. This is an opportunity. Do I think we should have a public hearing? Yeah, I agree. We should have a public hearing. We should hear from the public to see what they have to say. But I don't think we should be holding up the process because some people didn't do their homework. I'm sorry. You should have done your work.
I've
You
done
should
my
have
homework.
you should have gone and looked at it and not listened to, you know, just a couple people telling you this and that. So I think we need to move forward on this. Do I think we should have a public hearing? Yes. But I don't think we should be putting it to the 14th to delay the process so these people in Litchfield can find out. I mean, I'll tell you, if I was sitting there, I'd be going, I have no idea what they're going to do. I have no idea what we're going to do for an ambulance service. They need to prepare themselves. These guys need to prepare if we decide to go that route. So can we do it sooner than the 14th? Ron. I know the town manager is going to be out. Do we need the town manager here to have a public hearing? No, I don't think we do.
I think we're not going to come up with that live here now. We have to check our schedules and things like
Let's
that.
always check the schedules and nothing gets
Because that's what
done.
responsible people do.
Dan, if I can get a public hearing in beforehand, I will. I just got to make sure that we can get it scheduled.
You know,
Okay?
Ron, I'll tell you this.
It looks.
This is your typical response all the time, if I can. I have asked questions, and I'm still waiting for answers. Mr. Belinsky gets up here and he says he doesn't get answers. Well, join the crowd, all right? I'm on the council and I don't get the answers, all right? I just get, we'll look into this. We'll look into this. I'll get back to you. Never happens. We're going on midnight, and
We're not done.
We're not done. We're not getting anything done,
And we
Counselor.
have a meeting after the meeting.
Mr. Chair. So I've run your numbers again with your step two people, doing some math over here. So it would bring our wages down by about 30,500. And if we actually hired people at the age range that you've been hiring them, that they're usually not taking our health insurance and they're taking the buyout instead, and we're paying them out their retirement money, the deal actually becomes a net gain of about $192,000. Right? So
In year one, Ted?
in year one. So I think that would probably get us a lot closer to what maybe the other counselors might be looking at. So if that gives you guys any more of a factoid for you, if we're actually hiring at the rate that we're looking at, that we have been historically on the lower end of age range and skill,
And you basically,
So,
I based it off the,
the firefighter paramedic too.
Yes,
correct,
yep.
right? Which again, would love it.
right.
Would love to have it.
And if it was only the
Firefighter.
the
it's gonna be
F2
even
instead, that would even be a lower salary range.
much greater.
so Ted, are you saying that within your calculations, you believe this deal works?
Yes.
Okay.
Thank you, Ted.
You make a
Much
motion?
appreciated.
Well, no, can you repeat that, just so I can?
So if we're hiring at the historical age and experience that Phil's been hiring at for the past 2-3 years, at the F2 and F2 paramedic,
Firefighter paramedic rate, which again, if I get my firefighter paramedics, that's fabulous.
right, and that's at that
So we're still
slightly
we're
higher.
still projecting.
All right.
We're still projecting high here.
Right, and most of them have not been
I-
taking the health
I-
insurance as
yeah.
well,
Okay.
he's been saying. That's the bigger savings point of
Yes.
this.
So that's enough of a gap, and I guess that's where, when I said almost there, and I needed something bigger to make it a good deal, I think that's good. The only aspect of it I don't like is the not having a public hearing, but
All right.
I mean, that would get us to a net gain of $192,000.
Okay.
yeah, okay, I'm good.
I'm sending my 12-year-old to paramedic
I
school,
would
but
make
I
the
got a
motion
few more
quickly
years
before
before
we
I can get out of there. So I'm
Mr.
working
Chair,
on it.
I'll move that the
Hire in for
Londonderry
6
Town,
years, so.
Mr. Chair, I'll move that the Londonderry Town Council hereby authorizes the town manager to enter into an intermunicipal agreement with the town of Litchfield for the Londonderry Fire Department to provide transporting ambulance services in addition to EMS and fire dispatch services beginning on January 1, 2027 for a 3-year period. Further, I authorize the town manager to take all steps necessary to effectuate the agreement.
I'll second it.
I have a motion from Dan and a second from Sean. Any further discussion? Seeing none. All those in favor say aye.
Aye.
Any opposed? Chair votes in the affirmative. I want to appreciate all the discussion. So thank you guys very much. Litchfield, welcome. And please just know that we had serious concerns and it was not personal. Like, I felt like you guys were taking it personally.
Ron, I think the great thing about human beings is we're allowed to disagree and not be disagreeable, right? It's the truth.
So,
It's the truth, right?
yeah.
I think when we become
And I-
disagreeable, other things happen, and we don't want to see that. So,
And I think the discussion was well worth it, even though we're here till midnight. We got the end deal that we all feel comfortable with.
And this particular topic, in addition to all the other topics that we converse about, I just wanted to say personally, I appreciate the conversations that I've had with each and every one of you, and thank you so much for considering it. Thank you.
Thank you.
Thank you. And just to make it a little lighter mood, I just want to let everybody know that I learned a lesson tonight, and at least something positive came out of this. I will be conservative moving forward, but not that conservative.
Okay.
Thank you.
So,
Thank you.
Thank you very much.
thank you.
Thank you.
Appreciate you bearing with us and welcome. Welcome to the community.
Well worth it. Thank you. Have a good night.
Thank you.
Thank you.
All right.